If
It
you
is.
if you use an opioid receptor blocker, can you prevent the placebo effect from happening?
Yeah, that's what happens. Yeah.
I
So
see.
in these studies, sometimes there are other mediators that are involved, but usually in most studies there's a strong reduction in the
Hmm.
placebo
Hmm.
pain relief when opioid receptors are
Yeah.
blocked.
And
So when we put mice on that floor, they now know the environment. They will explore to try to escape heat pain. And they will learn that if they move to the other chamber that is still at 30 Celsius degrees, pain will go away. So they will experience pain relief by transitioning from the first chamber to the second chamber.
I see. So you're teaching the mice. You've got two chambers. They look a certain way. They smell a certain way. They start out at the same temperature, but then after a few days, you make one of the chambers too hot to handle for the mice. They don't like it, and they learn. Okay, if I go into this one, bad, too hot, and if I go in this one, comfortable. So you just train them to
Right.
discriminate these two locations based on temperature.
And we start the test by putting them on the hot side. So they have no choice. They have to find a solution to their pain problem. And so
Mm-hmm.
the treatment that they find is to go in
Mm-hmm.
the other chamber.
Mm-hmm. And so you can then directly measure and quantify how much they're expecting the other side to be hot, how much they don't like it by how much time they spend in the other chamber.
Exactly. And so they're really good at this. After just, one day or certainly after 3 days, you see that they spend almost all their time in a chamber that's not hot, and their latency to transition from the hot chamber to the chamber that is at 30 Celsius degrees is getting shorter and shorter. So they really learn the task well.
Mm-hmm.
And so here we think we have, after 6 days, recreated the expectation of pain relief. So then the other component that we need to test it is there actually pain relief? Do they experience less pain?
Mm-hmm.
And so for that, on day 7, we're going to trick them one more time. Now we're going to set both floors at 48 Celsius degrees. So they've just learned that where they start, they just have to move to the other side and experience pain relief. In that case, they go on the other side, it's still hot, and it's the exact same stimulus intensity. So they should perceive the same pain on both sides. What we see is that mice still show much less pain behaviors on the side that is associated for them with pain relief, even though it's the exact same pain in
Stimulus
theory.
intensity, same temperature,
Yeah.
but they're showing less avoidance behaviors or less vigorous avoidance behaviors, presumably because they have this association that's baked in.
Yeah, exactly. And going back to the opioid part, if we give them naloxone on day 7 before testing them, we lose this analgesic effect that's related to the expectation of pain relief.